Did you know that whenever you have a tooth that's missing, the bone that is there to support that tooth now has no stimulation? Your muscle's going to be shrunken, atrophied. The bone does the same thing. The longer you go without a tooth, the more likely that bone is shrinking over time and making it harder for your dental implant specialist to be able to replace the tooth, because they need good bone foundation to put the implant into. One of the things you can do is, if you're having a tooth taken out and you want to buy yourself some time, but maybe you can't yet afford the implant, you can get what's called a bone graft. And this graft it'll extend the time. It's not forever, but it'll give you a good solid year most likely, where you will have bone. If you're thinking at all of replacing your teeth, you should get grafts done, or maybe just get the implant at the same time the tooth's taken out if that's possible. Hope this is helpful. Take care. Bye-bye.